I'd like to welcome everyone to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. And with me today is my friend of many years, Dr. Lewis Flint. Lou is the editor-in-chief of Selected Readings in General Surgery. Welcome, Dr. Flint.
Thank you, Steve.
I have found Selected Readings in General Surgery to be very useful at many stages of my career, including back when I was a resident. So maybe you can give us a little encapsulated summary about it.
This year will be 15 years ago that I became the editor. It did start in the 60s under the direction of Dr. Robert McClellan at the University of Texas Southwestern Medical School, and later became available as a national subscription service in the late 1970s. And then when Dr. McClellan retired, he gave the publication to the American College of Surgeons. Shortly after that, I became the editor-in-chief. We have a relatively straightforward content preparation protocol. We have articles that we review, and I provide reviews of the individual articles. They are focused on a topic area. We have a series of topics, and I am assisted in each issue by one or more editorial associates. These are usually experts in the topic area that we're talking about. We find that the content is very useful for medical students and for residents and for practicing surgeons, especially those who like to learn by reading text. We are working to develop a podcast for people who would like to learn about selected readings but would rather listen to something. Each issue is about 52 to 60 pages long. The print version comes in a magazine, and the online version is accessible on a website and downloadable as a PDF document if the person wants to print it out. We have a faithful group of subscribers that are practicing surgeons, and then we have a fair number of residents and a few medical students who also use the publication. And interestingly enough, we have a few subscribers who are nurse practitioners and physician's assistants. We do a survey from time to time to find out what our readers are thinking. They, to date at least, have said that they think the content is valuable and relevant to the practice of surgery. So I'm gratified by that.
Quite a robust array of articles indeed get covered. A lot of work goes into it. Do you rotate topics?
We have a sequence of topics that cover the main focus areas of surgery. They are specialty focused, like breast surgery or colorectal surgery. They're also focused on topic areas like trauma, surgical critical care, surgical infections, nutrition, metabolic support. The sequence of issues is the same for every cycle. Currently, we have just finished publishing our 3-issue series on liver disease and surgery of liver disease, and we'll move from there to vascular surgery, and we'll have 3 issues on 3 different areas of vascular surgery: aneurysms, peripheral vascular disease, and venous disease.
Sounds like you're finding things that will interest every surgical resident, as well as, you say, medical students and people in practice. Last question before we wrap up. Is this benefit to participate in reading Selected Readings in General Surgery, or perhaps listening through a podcast, is it a benefit unique to fellows and members and candidate members and associate members of the college, or can one who is not affiliated with the college subscribe?
We have our subscriptions open to anyone who's a healthcare professional. We give a lower subscription price to fellows of the college and to people who are in the process of becoming fellows, like residents and some medical students and young surgeons who maybe are in the fellowship training or in the early years of practice. So if you're in the process of becoming a fellow or already a fellow, you get a reduced subscription price.
Thank you very much, Dr. Flint, for all that you do for us with Selected Readings in General Surgery, those of us in practice, in training, and not yet in training as medical students, as you mentioned, allied healthcare providers who aren't physicians or surgeons. It's a wonderful thing that you've been doing these last 15 years, and we wish you success in continuing to do it for many more years.
Thank you. I appreciate the opportunity to talk with you.
Thank you.